So the study that I'm presenting was an initial study to look at the safety, feasibility, and preliminary efficacy of combining this novel FLT3 inhibitor with standard chemotherapy for patients under the age of 60 with FLT3 mutant AML. Patients were enrolled onto the study if they were newly diagnosed, untreated, and were eligible for intensive chemotherapy. Now about 44 patients were enrolled at 6 or 7 sites. The data presented here will really be focusing only on the patients between the ages of 18 and 60 years old, because those were the comparison patients that were presented in a very large trial leading to the approval of midostaurin. So when looking at these patients 18 to 60 years old, the results showed that the addition of Crenolanib to chemotherapy was safe and very well tolerated. All patients received chemotherapy on time. 16 patients received chemotherapy with cytarabine and daunorubicin. 13 patients received chemotherapy with cytarabine and idarubicin, but these 29 younger patients did very, very well. All 90% of them tolerated full-dose Crenolanib. The adverse events were not significantly different than one would expect, but standard chemotherapy, there was no significant effects on myelosuppression and count recovery. And then when you looked at overall response rates, the results were very encouraging. About 80%, 86% of patients, or 22 of 29 patients, achieved a complete remission or complete remission with incomplete count recovery after up to 2 cycles of chemotherapy.